Hello, I'm Kelly Rodrigues, CEO and founder of Patient Centricity Consulting in Brazil, and today we have a special meeting. We have with us Kevin Wards, who is a program manager in the Community Engagement and Transformational Change Directorate at Healthcare Improvement Scotland. In Healthcare Improvement Scotland, he leads for the What Matters to You movement. What Matters to You is an international movement started by healthcare professionals to promote care and kind human interactions in what is an increasingly technical and busy health and care system. What Matters to You aims to encourage and support more meaningful person-centered conversation so that they are embedded and take place between people who provide health and social care and the people who receive it, as well as their families and caregivers. So, Kevin, it's a pleasure to have you with us. Firstly, could you tell us? Oh, sorry, tell me.
Thank you for having me.
No, it's a pleasure. So, firstly, could you tell us a little about the What Matters to You movement? How did it start?
Yeah, no problem. Thanks, Kelly. So, the What Matters to You movement is an international person-centred care movement that started in the US by healthcare professionals, and they were looking to promote basically kind, careful human interactions in what is an increasingly busy and technical health and care system. So it was inspired by the 2012 New England Journal of Medicine article sharing decision-making, the pinnacle of person-centred care, written by Michael Barry and Susan Egman Levington. So since then, basically come 2015, that's when Healthcare Improvement Scotland, from a Scottish perspective, got involved with the What Matters to You movement. I've been involved in it for the last 2.5 years, and it's been really exciting to be involved and really get a sense of the enthusiasm and determination of our healthcare professionals over here in Scotland, but also worldwide in terms of implementing the What Matters to You approach in their workplace. So it's been really interesting, and we'll continue to build on that, and in some ways became a bit of a world leader in it in some ways, but we've still got a long way to go, as do many other countries as well. So that's where it all started, and we're keen to build on that moving forward. So we've got our own dedicated website, and we also have produced a number of resources over the years in partnership with a number of different countries who have been involved in that as well. So extremely excited to be here and talking about it, and really keen to build on the movement as we move forward as well, Kelly.
Very nice, Kevin, very nice. And how can we apply what matters to you in our daily lives?
Absolutely. So from my perspective, I think a really good starting point, and I know when we met up previously, this was something that we discussed. A really good starting point for me is building it into teams. So within the hospital sites, a great opportunity there is to have these What Matters to You conversations amongst our teams and with colleagues, and that's really to support and building that culture that What Matters to You is all about is really important. So even within my teams at Healthcare Improvement Scotland, we've had these conversations. So there's really good tools that can help enable those conversations. I think from there, the key bit is then moving on to having those conversations with patients, and the way that I look at What Matters to You conversations, there are many ways of framing the questions that we're asking patients here. So, an example of that is when you have a good day, what makes it a good day? What else can we do to support you? What's important to you at this moment in time when you're accessing, the health and care services that you're currently involved with. So many ways of framing that question, and that goes a long way to really building into the culture. So as I said, we've been doing that within the teams. It's taking a kind of whole system approach really, to really building this and really making sure that when it comes to, these What Matters to You conversations, that they're front and centre of every conversation we're having. And, within the hospital sites and within the wards, there's many ways of doing that with some of the resources that I've got on the website.
So nice, so nice. So I'm very proud, and I'd like to tell everybody that we formed a partnership between Patient Centricity Consulting and What Matters to You to make the material available in Portuguese. So you can access all the material on the website www.whatmatterstoyou.scot. So please check it out. Kevin, could you tell us a case to understand how to put all this in practice?
Absolutely. So, got a few cases that I'd like to discuss. There's some really good cases on the website, so people can access them.
I saw.
There's a couple of good ones around having those conversations as teams and really getting to understand individuals and connecting at a deeper level. So that's a really good starting point. I think for me, I'm going to use a bit of a personal story. So a couple of years ago, I went in for an operation, and I remember meeting my consultant before the operation and pre-op assessment. And I remember just as the conversation was finishing and knowing that I'd be going in from operation in the next few weeks, he'd said to me, and as I said, there's many ways of framing the question, but he said to me, is there anything else I can do to support you in terms of, before you have your operation? And that's the kind of beauty of What Matters to You. It's opening up those conversations, giving the patient that opportunity to ask these questions. And in many occasions, the things can be pretty small. So from my perspective there, it was a great opportunity for me to say, when I was going under anaesthetic, the main thing I was looking for was that there was not many people in the theatre. There could be as many people in the theatre once I was under. And this was only from previous experience where about 11 years ago I did an operation, and when I was getting my anaesthetic, there was so many people in the room and I was petrified. So it was something that was really important to me, was to make sure that basically only the anaesthetist was there and maybe a nurse. And then after that, all the professionals could come in and undertake the operation. So I think that's the key bit of What Matters to You here, is there's many ways of framing the question. My consultant did it in quite a nice way. Probably even didn't think he was doing it, but that really enhanced the whole patient experience that I had. I went and had the operation and came round and was out of hospital on the same day. So it really shows the value in it. And another example would be where one of my colleagues, the sister was in for an operation, her sister was in for an operation, and the same kind of thing happened. But her sister's got learning disabilities, and off the back of that, she basically loved cheese. So the hospital site, I talk about these little things, the hospital site, nurses, consultants, everybody involved, cheese just appeared from everywhere for this patient. That is the beauty of What Matters to You. There's many ways of taking this approach and embedding it within our healthcare systems to really enhance that patient experience.
The little things are very important. So we need to focus on whole things. Very nice. Yeah. So Kevin, thank you very much for your participation. And I would like to say to everybody who is watching us that we can indeed deliver a good experience for our patients, and understanding how to implement the What Matters to You approach is very important to delivering good patient-centered care. So take advantage of the free downloadable materials available on the website and encourage your team to work together on this approach. So let's improve the patient experience together. Thank you very much, Kevin.
Thanks, Kelly.